Now that we know the purpose of healthy anxiety and the difference between disordered anxiety and healthy anxiety, we'll talk about how to manage it. But first, let's consider, why do we need to understand and accept anxiety as a normal and helpful function of the body? Well, I'll tell you. Understanding anxiety as a normal and typical function of the body sets an expectation that we'll have to live with some amount of anxiety. And without this understanding, one will begin to recognize all anxiety as abnormal and a threat. And what happens when our body detects a perceived threat? Our body's alarm system starts to sound through what? Anxiety. So, if all anxiety is a threat, I'll begin to have anxiety about my anxiety. You see how this can snowball rather quickly. So the first step is to recognize anxiety in the body. We already understand that anxiety is the body's alarm system. That anxiety in our body signifies a potential perceived threat. So once I've identified anxiety in my body, my job is to introspect a little and try to identify why I'm anxious. What is it, the perceived threat that's causing the anxiety or those sensations? And the earlier you can identify this, the better. The last thing we want to do is ignore those sensations within our body. Remember, this is our body's alarm system. It's alarming that there may be a perceived threat. It will continue to alarm until our brain gets the message, until that alarm understands that we hear it. So we need to learn to interact with that alarm, that part of our body, differently. And the earlier you recognize those sensations of anxiety, the lower the severity of the symptoms will be. They won't be as bad early on. They will increase in severity as the alarm needs to sound louder and louder.